Doc Alice, you just saw my video about my experience in doing that prep for colonoscopy and actually experiencing colonoscopy. So, what did I actually experience? Why did I have to do the cleanse? And what did I experience during the colonoscopy itself? Um, Doc Alice, by the way, is a family doctor. She's a friend of mine, and she's gonna talk about scientific stuff about colonoscopy and why she actually encourages us to do it.
Hi, Luis. Thanks for inviting me over. Actually, when I saw the video, actually, you reminded me of what I experienced before because I've done colonoscopy myself for
Oh,
twice already.
you
So,
have? Oh, okay.
yes. So that's why you kind of reminded me of my experience. And I know it's not easy. It's not easy to go through that, but you really have to be prepared very well in order to get a clear view of the intestines. Okay, so I know it's kind of hard, but you know what? Didn't you lose about what 4 to 5 pounds?
Probably, probably because not just during that day, but 5 days before, I was already reducing my intake of food, especially fiber. I even had to take out the vitamins. I checked it out on YouTube. There are so many things, including aspirin or. Yeah, tell us about that, like the prep. Why do we have to do that very rigid prep schedule? The
But basically,
preparation.
is to really just to have a clear view of the whole intestine because the scope, there's a scope that's inserted through the anus and it goes all the way up to the that part where the intestine is on the
The
around the
transverse.
liver area actually, yeah.
Right.
So it's really to have a smooth insertion of the scope
Hmm. And
because if
my
there's
doctor said,
some yeah, if it's unclean, then it's so hard to look at the whole view of the
mm,
intestine. So even the small polyp, you might miss it if you have an unclean preparation.
my doctor said I had a good prep, meaning it was clean. Thank God. Yeah, the effort was enough. Thank you. And
Right.
also that he did not find any polyp. So what does that mean?
Oh, congratulations.
Amen. They said it's normal. So what does that mean? What are they looking for?
Yeah, basically they're looking for polyp, as what you mentioned. If there's any growth, any suspicious growth in the inside the intestine, and actually the recommendation to get a screening colonoscopy is age 50 and above. But if you're an African American, the recommendation is 45 actually.
I'm
Okay.
actually just in
And
my 30s. I'm not in my 50s.
okay. But if you have also a family history of colon cancer, so for example, if they got diagnosed at age, let's say 40, then if this is your first degree relative, the recommendation is for you to get it 10 years earlier.
Mm.
The age of diagnosis of your first degree relative. So, for example, if your mom was diagnosed at age 40, then you're encouraged to have it done at age 30.
I mean, thank God
So,
I got the normal test, and they said that I should do it 5 years hence or 10 years hence from now. How about those people that did not take it and then they saw something? So, what do you actually tell those people? And would you actually encourage people to ask their doctors to do their colonoscopy test?
mhm. So when the GI doctor sees a polyp, so that's being removed because studies have shown that it could be a predisposition for cancer. Okay. So,
Mm.
but there are other options. If people who really are scared of doing colonoscopy, there are other screening options. So that is number one is doing stool exam. Okay, but that's going to be every 2 to 3 years. There's also another procedure that's called flexible sigmoidoscopy. So that's just looking at um, the last part, you know. the last part
Mm-hmm.
of the intestine, and that's going to be like about maybe every 3 to 5 years. But with colonoscopy, if you have no family history of colon cancer, then every 10 years would be good.
Actually, not changing the topic, but someone in the Philippines were saying, oh, yes, they're already in their 50s and they want to do it, but they say they'll wait for the vaccine. So tell us about your advice to her when she mentioned about she will wait for the vaccine when she will do this procedure.
So are you referring about the COVID-19 vaccine?
Correct. That was her
Okay.
question. Correct. Yes.
So the recommendation is to, to have the test like 3 days prior to the procedure, just to make sure that you're clear
Yep.
and you're not going to be exposing the healthcare workers, the
I
doctor
did.
itself.
I did that, and it's a requirement, or else they
It
won't
is.
give it to you. Yes, it was a requirement that I pass the COVID test. But the question was, she will wait to do the procedure when there's already a vaccine in the Philippines. That was a question.
Well, oh, okay. Oh, sorry. So I was talking about the test, right? The COVID test should be done 3 days before the procedure.
Right.
But getting vaccinated, but we don't have to be vaccinated in order to have that procedure done. Okay. Well, as long as you get tested and you're negative. Okay. But it would be great, of course, if you go for the COVID-19 vaccine because the only way to stop or to eradicate the this pandemic, this global crisis, is to develop a herd immunity.
What is herd immunity?
So herd immunity is a form of indirect protection, okay, of by having this percentage of sufficient percentage of immune population.
Mm-hmm.
So what I'm talking about is if, for example, with measles, it took about 90% of the population to be vaccinated in order to develop herd immunity.
Mm-hmm.
So that 90% is protecting the 10% of those population who cannot or who have lack of immunity. So in other words, with COVID-19 vaccination, they're projecting 70 to 80%. If 70 to 80% of the population is vaccinated with COVID-19, so that means we protected those who are unable to develop immunity, those who have suppressed immunity
Right.
and who cannot get vaccinated. So we are protecting them.
Okay. So I do encourage people to get vaccinated. Obviously, you encourage people to get vaccinated, right? Yes.
Right. Yes. Because that's the
Right.
only way. That's the only way to eradicate this global crisis.
Of course, there are people who are not capable or will not take the vaccine because of medical reasons. Who are those people?
To be honest, from what I've read, only those people who have allergy to polyethylene glycol or Miralax, actually the one that you just drank, which is part of the preparation, right? Miralax, that's
Yes, yes.
polyethylene glycol. So people who are allergic to that, they're
Okay.
contraindicated to get the
I guess I'm
vaccine.
I'm not allergic because I
So
don't get okay.
yes, yes. So you qualify,
Because I
right?
do I because I do have allergies as well. But otherwise, I guess discuss it with your doctor, obviously, and you will be told if you're already qualified. Because my insurance, I mean, the medical facility that I go to have been emailing me that hey, we're gonna have the vaccine, but we will tell you when it's already your time. So, are children, by the way, are children gonna be vaccinated or they're not gonna be vaccinated?
So for now, it's 16 years old and above qualify
Oh,
for the
gotcha.
vaccination.
And right now we're encouraging the senior citizens. I think the bracket right now is 65 above, right? Here in New York City
Right.
at least.
So
Okay.
phase 1A are the healthcare workers, so those who
Right.
are directly exposed to people with the infection or hazardous materials,
Mhm.
and also the nursing home residents. Okay. So phase 1B, we're now on phase 1B. where 65 and above qualify, as well as frontliners, teachers, so and so on and so forth. There's a list of frontliners that are qualified to get the vaccine right now. But
Doc Alice?
there's a
Yes, yes, yes.
yes,
Because I was gonna say thank you very much. Because soon we're gonna have a longer interview. But do promote. I know you have a lot of clinics that you actually work for. But can you promote the new clinic that you actually have in the Woodside, in the Filipino area in Woodside, Queens, New York?
yes. Thank you, Louise. So I have a primary care practice in Woodside, Queens. It's the Little Manila of New York, and we're open from Monday to Saturday from 9 to 5, and also Sunday 9 to 2, just to do COVID testing. But every day, we do COVID testing. We offer it free for the uninsured, and there's no copay or deductibles for those who are insured. And soon, I already ordered 100 doses of Moderna vaccine, but I'm still waiting. I know there's a shortage, but I'm just waiting.
Sure. So, yeah, do email us or tell us about what's up with vaccine, and maybe you can come back and talk about just the vaccine topic. So, tell us your
Okay.
phone number and maybe your email, phone number, your email that we can contact you or
So the
website.
office number, okay, the office number is 917-633-7710. You can call, or you can also text your message in that number. Again, that's 917-633-7710. And the email address is almendralpcp@gmail.com.
Thank you very much, Doc Alice. We're certainly gonna be talking about this again really, really soon. So, thank you and God bless. Thank you for your